Welcome, and we're going to get started today. We're focusing on chiropractic and just really trying to answer some of those questions when a person's just not sure, how do I approach chiropractic? How do I approach spinal health? And is this for me? What would be the right approach for me? So we want to answer a lot of those questions, but it's really not, I've never had a patient come into me and say, I want to have the healthiest spine in the world, or I want to make sure that my spine never gets bad, or I don't have problems with it. What people come in saying is, I want to have better health. I want to have a great life. I want to have great outcomes. What we really desire is health. That's what we want. Chiropractic can just allow you to have better health or support you to have better health. That's really the value of chiropractic care and making it a part of your lifestyle. So we want to answer a lot of those questions, but just first, a statement or something I'd like to share with you. I personally believe health is one of the greatest gifts that you were given. I really do. But with that being said, who's responsible for you being healthy? And the answer is you are. You're responsible. You're the one that's making decisions. Every day you make hundreds of decisions. They move you closer to health or closer to disease. And it's really you're driving the boat. And so just because you know somebody that has a certain level of education doesn't mean that you have great health. And so what you understand matters. And how you understand health and how you apply it, it influences your life, how you feel, how you work, how you are around your family and your friends, your relationships, what you can do, what you can't do, how much money you can potentially earn, or how you can retire. Those things matter. Health influences all of your life. It influences everything. And so what you understand makes a difference. And so the goal would be, we can just give you a deeper understanding of health and how you can approach it and have better outcomes and more intentional outcomes. So that's really the goal there. So hopefully that would be something that would be valuable to you. So with that being said, health is one of the great gifts that you were given. Defining health is really important. What is it? And so the question here, what is health? That's a powerful question. And very few people are answering this question clearly for themselves. And so the myth that most people were taught is health is how you look or how you feel. That if I just look healthy, I'm good. If I just feel healthy, I'm good. Yet of the leading causes of death, we're talking heart disease and cancer, they're considered silent killers. A person can feel really good, go home that night and drop dead of a heart attack, even though they felt good. You can have 99% blockage in the main artery of your heart, and you can feel fine. A person can feel great and find out that they have tumors from the back of their eyes all the way down to their legs and not hurt. And so if some of the leading causes of death are silent killers, judging your health on how you feel is not always a wise decision. So what is it? It's not how you look or how you feel. We want you to look good. We want you to feel good because you're healthy. Health is really about how your body functions. And there's a couple different ways that it's defined, but if you simplify the definitions so that it's useful, the most helpful way that I can explain it so that you can use it to your advantage and actually apply it to your habits and your decisions, because that's what we want. We want to define it so you can apply it. Health is all about function. If things in your body are working properly, if they're functioning properly, you stay healthy. If they're not, you're in trouble. So health is all about function. That's what we want to know. How do I stay healthy? Then my body's got to function right. If it's not, I might end up in the emergency room. I might end up on respirators, on you name it. Health is all about function. So that's what we want to see. So the next question that's really important, if health is function, then what is it that controls all function in your body? What is it that controls physically how your body functions? And the answer to that is your brain and your nervous system. It's your brain that communicates life down the spine and out the nerves. And that's what tells your heart to beat. That's what tells your lungs to breathe. That's what tells you to digest food and turn it into living, breathing tissue, for you to regenerate new cells, repair, for you to heal. The nervous system controls it all. And this is why, if you take, for example, your brain sends a message down the spine and out the nerve, and that tells your heart to beat. If you cut the nerve that goes to my heart, what do you think is going to happen to me? Yeah, I would die. I would be dead. If you cut the nerve of my heart doesn't work, it's game over. And if I tell you, but I'm a really active person or I'm a really healthy eater, those are good habits. They contribute to a healthier body, but the nervous system controls it. So if you cut the nerves, the organ fails. Well, instead of cutting that nerve, if we damage the nerve, the organ struggles. It can shut down faster. It can build disease quicker. It's not going to work as well. So health is function. We know that your nervous system controls all function. So knowing that, a question that's really powerful when it comes to you having good health is, what protects your nervous system? And the answer is Your spine. And so I know some of these are basic, but when you start to connect the dots and then apply it, you can change your future. And so health is function. Your nervous system controls how your body functions, and your spine protects the nerves. Now, here's the kicker, and that all just kind of makes sense. Now, here's the thing. So what could you take care of to keep your nervous system healthy? And the answer is your spine. When you take care of your spine, you're going to have a healthier nervous system. We know that. You think about what's the posture of most people in assisted living or a nursing home. They tend to be hunched over and they tend to be rigid. They tend to, if they turn to say hello, have to turn their entire body. Because when your spine starts to break down, your body becomes limited. You can't have a rotten spine and a healthy nervous system. It just doesn't work that way. The spine protects the nerves. They're intimately related. They're connected in such a powerful way when it comes to your health. Now, the challenging part is this. It's common sense that the nerves run the body and that the spine protects the nerves. But there's very few people, or there's a small percentage of the population that's really good at taking care of the nervous system because they just haven't been taught how to do it. And so that's the difference between people that come to a clinic like mine and maybe somewhere else. If you hear somebody that's just raving about chiropractic care and how that's blessed their life and changed their life, most of them have made it a priority to take care of their nervous system consistently and regularly. They just make it a part of their life. So I've never seen somebody that says, I'm going to eat really healthy for 2 weeks and I expect it to last for the next 50 years. They know that's just not going to work that way. I'm going to exercise really well for 2 weeks and that's just going to last the entire rest of my life. It doesn't work that way. Yet people think I'll get adjusted once or once in a blue moon and that's just going to keep my spine healthy for the rest of my life. And it doesn't work that way. If you're doing healthy things, you do them consistently and regularly. And when people say the nervous system runs everything, the spine protects it, let me take care of the spine. When people are regularly getting adjusted to promote healthy function and to promote a healthier body, those are the patients that I see that have the best outcomes and the longest, most predictable outcomes. They have longer health and better health. And the research shows that if a person's getting adjusted regularly for 5 years or more or 8 years or more, when they look at these different studies, what they're finding is those people will take 85% less pharmaceutical medications. They have 62% less hospital visits. They'll save on average 69% on their overall healthcare costs over the course of that time compared to someone of the same demographic. And so the point is, when you're consistently taking care of your nervous system, you're going to have better health outcomes. That's what we're seeing. Yet that's like when you connect the dots, you're like, that just seems like common sense, but it's not always common practice. And so when people start to connect the dots and make it common practice, they have better outcomes. And that's where I think that you can really use this to your advantage to have a better health and a better life. And it starts with getting checked and evaluated with someone that's trying to help you get there. And so you have your goals, but also you should say, what's the goal of your doctor? Because so many times the goal of the doctor is just to treat the immediate symptom or just get you out of the immediate situation. Very few times is your doctor actually trying to say, how am I going to keep you healthy 15 years from now? What are we going to do to make sure that you have great health 20 years down the road? There's very few doctors that are set up to do that or given the freedom to do that. And so when people are doing what they call corrective care or wellness care, those tend to be the doctors that are going to focus on that and get you there. People that are doing more pain care or relief care, they tend to be focused on just the immediate thing. And and we need everybody. We need all of them because they all add value. But there's a difference. And so really it comes down to what do you know and then what do you want? Where are you trying to get to? And so we know health is function. We know your nervous system controls it. We know that you get to take care of it. But it just depends on, are you getting evaluated and are you working with a doctor that's trying to get you there? And these are questions you can ask. Where are you trying to go with this? You ask the doctor, what do do you feel responsible for my long-term health? Are you trying to help me with my long-term health, or is your focus mainly on this immediate thing? And ideally, it should be a little bit of both. So that makes sense to so many people, but the confusion can come on, well, how are we approaching this? And here's an area of confusion, so we want to bring clarity. Are we doing pain care or relief care? Or pain care or corrective care? That's a big deal. A lot of times, if the expectations aren't communicated, you can get frustrated. And so the people that I've seen that are frustrated with either their health care or their chiropractic care, nobody really communicated expectations. So You have expectations of the doctor and expectations of the patient, but they're not being communicated and they're not necessarily on the same page. So at some point you can get major frustration. And so what are you trying to accomplish? Yes, we want to address the immediate concern, but are we trying to correct the underlying issue so the problems don't keep showing up? Or are you just trying to get the person out of discomfort and just let them come back as soon as the problem shows up again? Almost like if the tire's flat, you fill it up with the air, you watch it go flat, you fill it up with air, you watch it go flat, you fill it up with air. A lot of times that's what's happening when we're just treating the pain, because we're not necessarily getting the person healthier or getting to the cause, we're just getting them out of that situation. And there's a time and a place for that. And if that's what you need, that's a good thing. But corrective care is focusing on going a lot further than that. And so here's some things that you need to know when it comes to, or that are helpful to know when it comes to corrective care versus relief care. One is, what's normal for a spine? Am I just trying to make it not hurt, or do I actually want it to work and function better? And so we're going to go through some examples of what might be normal. And so as we pull up these x-rays here, this is the spine looking straight on. And so what you see in the image on the left here, here's the skull right here, and then you have the left shoulder and then the right shoulder, and then the blue line is where the spine sits straight up and down. That's normal. From the front, the spine should be straight. That makes the body stronger. It gives strength. We look at the x-ray on the right, this is the lower back, and what you see here is the left hip is here, the right hip is here, and then the spine goes nice and straight up and down. That's normal. That's the way that the spine should look. When the spine is straight, it's strong. So think of it this way. A straight spine is like a straight nail. If a nail is straight, it has strength to it. If a nail is bent, it becomes significantly weaker. And so if you hammer on a bent nail, what happens? It wants to bend more. If you have a spine that's straight, it's strong, but if your spine is bending like a nail is bending, which happens commonly, they call that subluxation, where the spine starts shifting out of alignment. If it starts to bend like that, now stress and gravity and just the forces of life that wear on your spine are like a hammer just tapping on a nail, and it can start to bend more. And if you just leave that go, it's just going to continue to get worse. The spine's going to degenerate quicker. It's not going to last as long. And that person's just not going to have the same quality of life that they could have had or that they were designed to have. So corrective care is really focusing on, can we identify those root issues and get them to improve and correct? And you're going to see less pain and less discomfort, but you're also going to see a healthier spine and put yourself in a position for longer and better outcomes over time. So that's really powerful. So that's what we want to see from the front. Now, when we look from the side, what we want to see is the spine should have nice, healthy curves. And so when we look up here, what you see on the image on the left, that's the jaw and the teeth. And then here's the skull. And then there's a normal curve in the neck. There should be 3 curves, one in your neck, one in your mid back, and then one in your low back. The x-ray on the right, there's a normal curve in your low back. And if you zoom in here or you take a closer look, what you see right here, the square, that's the bone. The spacing between there is the disc space. And then the canal right here, that's where the nerve comes out. So normal bone, normal disc space, normal spacing for the nerve to come out. That's how the spine should look. Same thing on the left, bone, disc, and then there's the nerve will come out right behind here. So that's what we would want to see within the spine. We want to see a nice, healthy curve in the spine. If we don't see that, a person's not going to do as well. And here's what I mean by that. And so I would show you some examples here. I want to just walk you through a couple things. So let's move to this here. So when we look at the spine, so this would be right here, this image here, this would be a normal x-ray of the spine. And then right here, this is a cross section of what the spine would look like. You have the darker squares of the bones, the little white little bead looking things there, or pea looking things. That's the disc. And then this white line behind that, that's really important. That's the spinal cord. When you have a normal curve, you have a spinal cord that sits nice and relaxed. And so as you're sitting here, I want you to just try this, and this will help you understand the spinal cord. If you take your hand and make a C shape with it, just go ahead and try that once. And then look at the skin on your palm. And what you should notice is the skin actually starts to wrinkle. When you have a curve in your hand, there's no tension on the skin. It sits relaxed. And the same thing is true here. When you have a normal curve in the spine, the spinal cord will sit relaxed with no tension. Now, if you take your hand and you straighten it out, you should notice that the skin will start to stretch, or it starts to pull. It takes the tension out of your skin, and it starts to get tight, or starts to get taut, is what you'll notice. Well, when you have a normal curve, you have a nice relaxed spinal cord. And if you look down the spinal canal, if you were to look straight down the hole, what you would notice here is that's a healthy, thick spinal cord this cord is going to communicate life to and from the organs at a very high level. But what happens is when we lose the curve in the spine, we begin stretching on the spinal cord, just like what you felt on your hand. And that creates what they call pathological tension or disease-causing tension. That's what some of the neurologists will call it. And when you start to straighten out the spine, when you look down the canal, because it's stretching on the spinal cord, it's going to affect the spinal cord. And what you start to get is a spinal cord that begins to thin out and actually deteriorate. It will cause the nerves to start to deteriorate and wither. And so if we look at these two people, the person over here has a healthy spinal cord, the person over here has a deteriorating spinal cord. Of these two people, the person on your left or your right, who's going to get disease first? Well, the person on the right is much more likely to get disease and sickness. And this sometimes is where a person can be feeling like they're hitting a plateau where they're doing as much as they can right. So let's say this person here, they could be eating well, they could be exercising, they can be doing a lot right, but they feel like they're going backwards when it comes to their health and just their ability or even their symptoms. Yet this could be the person where it seems like they do everything wrong and it just doesn't seem to faze them. This body is going to function better because they have a healthier nervous system than this one here. Now, obviously, we want to have good habits in all areas of our health, but I want you to understand, or it's helpful to understand, how important those nerves are to your body and your overall outcome. And so if a person's stuck in a position like this, you can get them out of pain, but if you leave them there, the problem just continues to progress. And that's what we don't want to see. But if we can transition them and get their body or their spine to correct and improve from here and move closer to something like this, we're going to see better health and longer health and better outcomes over the long haul. So let's say your spinal cord goes from here and starts to transition from here. What's going to happen? Your body's going to get healthier. And so let's get back to some x-rays. So this would be normal, a normal curve in the neck and the shoulders. Now we look here. This is an example of abnormal. So in this image here, the red line is a more normal curve. That would be an ideal curve, is the red line. But the yellow line is where the spine sits. And so it's completely straightened out. Now, in that posture, you say, well, is that person going to be healthy or sick? Well, their body's not going to function as well. They're going to struggle and they're going to have more symptoms. Or maybe not more symptoms, but they're likely to have more issues. This body right here will not last as long. So that's an abnormal spine, and that's an abnormal x-ray. Now, if you leave it there over time, what's going to happen? It's going to get worse because you have stress over time is not a good thing for your body. So you continue to take that spinal cord and stretch it and pull on it. And over time, it's just going to continue to get worse. The other thing is it's going to wear on the joints and the vertebrae. And so imagine this. If you are, imagine that you're helping a friend move and you're standing in the back end of a pickup and you're handing down boxes and you get done moving. And then now you're going to jump down from the tailgate of the pickup. If you jump down and you land with your knees bent, your knees absorb the force and you can do pretty well with that. But if your buddy says, hey, when you jump down, why don't you jump down and land with your knees straight? Does that sound like it'd be a painful landing? It's like, absolutely, it'd be a lot different than landing with your knees bent, because when the knees are straight, now you don't absorb the force. It's the same height, same distance, same factors involved, but now that landing just got a lot more uncomfortable because your body's not absorbing the force. And that can be really hard on your knees, your ankles, your hips, your back. It can be hard on all of those joints. Well, the same thing is true when you lose the curve in your neck. Now you get gravity pushing down on your spine, and it's almost like landing with your knees straight, that it's stressful on the joints, and you can actually get degenerative change and arthritic change a lot faster, where the discs start to thin out and wear out quicker, where the bones start to lay down more calcium, and that's where you can start to talk about degenerative disc disease, degenerative joint disease, arthritic change. That's where you can start to see some of those issues. And so the longer you leave it there, the more your spine is going to want to age and deteriorate because of the stress over time. And so when we look back at this x-ray, so here we see where the spine has lost the curve. So this is one of our patients where they had lost the curve. And instead of just, well, she had gone to chiropractic before and she was always just taught to treat the symptoms. So if she had a headache or neck pain or discomfort, she'd get adjusted, and it did help. It made a big difference because it helps the body to work better. But the root issue was not being addressed, where the spine wasn't improving. And so here's where she sat. We start working with her with corrective care. We start really getting really intentional with how we were adjusting her, what we were doing for home care, how we were taking care of her spine. We began to see her spine correct and advance and improve. The x-ray here on the left is her original x-ray. This is her spine after her first year of care. And what you see here, the red line is a normal curve. The yellow line is her spine. It's not perfect, but man, is it way better. And what you see there is a more normal curve in her spine. So now when you look at something like that, that's the spine starting to correct and change. And it can happen in a lot of people. And not everybody are we going to see that change, but most people we will, depending on their specific issues and what we're seeing as far as their ability and their potential. Now what happens is you look at a spine like that and you say, okay, now who's going to have, so we look at a spine like that and we say, well, of those x-rays here, who's going to have the healthier spinal cord and the healthier body? The person with the curve is going to have a healthier spinal cord, a better functioning body. The person without it's just not going to do as well. And so if we leave that here in a position where it's straight, they're just not going to do as well. So if we can correct it and stabilize it and maintain it, we're going to see a significantly better outcome. And so that's one of the main differences between corrective care and just pain care, is that we're actually working to see the spine change structurally. But then from there, if we can maintain it well, instead of just letting it go back, what if we maintain it well? Now we're really talking where we're going to see good health outcomes. And a person might say, well, why would we even need to do that? And the reality is because we live in a culture that has more unnatural stresses than ever before. And here's what I mean by that. Your spine is designed where you sit. Your spine is designed where you should sit up straight, ears over your shoulders, head back, and we're designed to move. That's normal. Yet we live in a culture where we're on the computers for long hours of the day, where we're sitting down, stretching, or putting stress into our spine, where we're sitting on our cell phone, putting this idea of text neck is a big issue, where it's very stressful on the spine, the structure, the neurology. Where we're driving in cars, we're sitting in front of televisions. All these postures are very unnatural, and they have a wear and tear effect on the structure and the posture of the spine. So it's harder to take care of a spine today than it was 20 years ago, 50 years ago. It's a lot more difficult because of our lifestyle and because of how much things have changed. And so if we work to correct the spine, we see a lot better outcomes. So that's what we want to see there. Now I want to show you just an example of the spine from the front. So what you see here, this is the low back from the front. Here's the left hip, the right hip, red line straight up and down is normal. The X-ray on the right, that's a spine that's begun to subluxate. And so what you see there is the red line is normal. The yellow dashed line is where that patient's spine is sitting, and you can see it starting to shift off to the side, almost at an angle there. That's subluxation. That's where you start to get the spine shifting, and now the bones that are supposed to protect the nerves are actually beginning to irritate them and actually can cause damage to the nervous system and to how the nerves work. And if you leave that go, that stress over time is like hammering a bent nail. It can just bend more. So the X-ray on the right is one of our patients. This is their original X-ray when they first came in. The X-ray on the left is their spine after their first year of care. And so this patient, Tim, he was actually able to avoid having a spinal surgery. They were doing steroid injections into his low back. They were going to do a surgery to his spine. He ended up canceling the surgery, started with corrective care. We saw his spine progress and improve. It's been over 7 years. He's never had to have that surgery, and he's still working full days with construction, which is just phenomenal to see. So he's done really, really well. And that's just his body functioning better. It's his body continuing to do great because his body's working the way that it was designed to. And so that's a big deal are we working to just relieve pain, or are we working to correct the spine? And so I would say that's a big difference between what a lot of people have experienced. Most of my patients that are coming in have never actually had corrective care, but many of them have had chiropractic care. And so a lot of times what I'll hear when they come here is they say, I didn't think I could get better. I didn't know this care existed. I didn't know that I could advance this far. And it's really because we're focusing on corrective care. And a lot of them that have been under chiropractic care, I'll tell them, I'll say, you would be in a worse spot had you not been getting adjusted. That has helped you big time. I think we can just build on what you've already been doing. But so there's a big difference between corrective and relief care, and having a consistent schedule or a consistent approach to how you take care of your spine. And that's dependent on the person and their situation and their goals. It's really, what's your goals, what's your outcomes, and what are we doing in between there? What's your lifestyle? Those three factors play a part into a patient's frequency. Now, the other thing is this is a difference is someone might say, well, what about insurance versus private pay? And insurance is actually there to help manage risk. So you think about it with your car insurance. Your car insurance, it's not there to keep your car on the road. They don't really, their job isn't to say, do you have nice, healthy tires? Do you have, are you getting your oil changed? That's not the job of your car insurance. Your car insurance is saying, if there's an accident, are we partially responsible? They're just trying to minimize risk. And health insurance is very much like that. It should be called crisis insurance. in a crisis, they're going to help minimize risk depending on what you're set up for and what the problem was, right? They're not there to get you healthy. That's not their job or their responsibility. That's your job and your responsibility. But sometimes we can forget that. And so what I see is if we're just doing what insurance says, usually they're just going to be there to try to decrease the symptoms and decrease the discomfort, but not necessarily get to the root cause of the issues or stop the underlying issues from persisting. Versus if someone's coming in and they're saying, I want to get my spine to correct, or I want to take care of my health and have great outcomes, usually there's a limit to how far insurance will help or make a difference. It's almost like, I guess maybe a good way to look at it would be to say, like, someone that has their teeth, insurance might pay to have your teeth cleaned, but if your teeth are crooked, very rarely does insurance pay for braces. A lot of people, they're paying for that out of their own pocket, $8,500 or more, just to have braces put on their teeth to get their teeth to actually correct and change. And then when they're done taking the braces off, after however many years that might take, then they're saying, here, take this retainer, wear this retainer, and say, why a retainer? So that your teeth don't go back. And it's almost a similar thing. If we want to get the spine to correct, insurance is only going to help so much or not at all. So that's why we work really hard to make our care affordable so that we can see families get well and stay well. But that depends on everyone's individual situation. But most people, what they find is if they're paying for their health up front, they're more committed. And then over time, what happens is as they're healthier, they spend less on healthcare. Again, I said they have one of the studies that show that people that were under consistent wellness chiropractic care, where they're working to maintain their spine healthy, spend on average about 69% less on their overall healthcare costs. So you being healthy is a lot more cost savings to you than you being sick or you trying to manage a problem or just manage pain. So that's a big difference too, insurance care versus private pay. The other thing is just, well, what are we doing? Am I just doing this for a period of time to get pain relief, or am I making this a lifestyle that I would be under lifetime wellness care? And the reality is this, for me, I will get adjusted for the rest of my life. My wife will, and my kids will, because I believe that's one of the best things that we can be doing to keep our bodies healthy. Because I know the nervous system controls my body and it controls my cells and organs. And if I want my body to stay healthy physically, I've got to have healthy nerves. So I am regularly getting adjusted, and so is the rest of my family, because I love them that much. I just prioritize that. My patients, I'm recommending based on their spine that they're taking care of their spine their entire life. Depending on their situation will depend on their frequency. But I know if they want to stay healthy, that would become a lifestyle for them. And so there's a big difference between lifetime wellness care and just pain relief. And the reality is the choice is yours. You can choose how to approach it, but just know that there's a difference. And so if you're only going in like as needed, only when you're hurting or in major pain, then you're not doing really wellness care at all. So you're having a different outcome. So if that's only been your experience, you've never actually had wellness care. And so there's probably more out there for you than what you've experienced. And there's likely a better outcome than what you've experienced. And so that's just something to pay really, really close attention to, is lifetime care versus relief care. And just another thing I want to just ask you is this: when it becomes a lifestyle and it's a lifetime wellness care, what you're doing is you're creating a habit that allows you to have the outcome you want. And so here's a question for you. What if you created habits that get you where you want to be in the future? What if that was your focus? You're saying, yes, I want to improve where I'm at now, but yes, I want to create habits that get me to where I want to be in the future. A person that does that, they do significantly better. And we see people that are 5 years down the road, 7 years down the road, 12 years down the road that have been in the office, where they're saying, when we meet with them, we say, hey, wow, we're celebrating 8 years, we're celebrating 1 year, we're celebrating 12 years. And the most common conversation that I have is people having the attitude or the conversation of, thank God I kept this a priority, even though, and then they fill in the blank. Basically, they're saying, even though life happened, even though there was that season where I lost my job, or that season where we had a summer that was so busy, I don't know how we kept up with all the activities, but we kept our adjustments a priority. Or even though I had that season where I lost 2 family members in a relatively short amount of time and it was just wearing on me, thank God I kept this a priority, even though, because it's allowed me to sustain a higher level of health. I'm just so grateful for where my health is. And I wonder, for those of you, if you've never been under corrective care, if you've never been under wellness care, if you've never prioritized that with the outcome of how can I sustain health over time, I wonder what that would do for you. And so if you've never had that done, getting checked, getting evaluated, that could be a game changer for you. It really could. And so a clinic like ours could make a difference. Inspired Chiropractic, we're in Sioux Falls, South Dakota. Come and meet with us. But if you're looking for somewhere else, what you want to look for is someone that does corrective care or somebody that does wellness care, because they're going to be more focused on that for you. That's a big deal there. But then here's the other thing is a lot of times the patients that rave about chiropractic care the most tend to be patients that are doing correction and doing wellness, because as their spine changes and maintains well, the brain and the body function better. So Dr. Heidi Havoc is a researcher out of New Zealand, and her team have been doing tremendous amounts of research on the effects of the adjustment. And what they know is the best benefit of the adjustment is it improves brain function. That when you're getting adjusted, your brain actually functions more efficiently. It's almost like rebooting a computer that's running slow, and you restart it and it runs more efficiently. The adjustment is essentially rebooting the brain to run more efficiently. And that's what they're finding. The research is just showing more and more and more that regular wellness care is the best benefit that you're going to get from chiropractic. Yes, a person can get out of neck pain or back pain. Many do with chiropractic care, but the regular wellness care is where people see the best benefits. And I see our best outcomes from our patients that are actually seeing correction. Those are the ones that have the best change and the most lasting change. And so I want to read just a couple stories or testimonials from you. So Dawn is a patient of ours, and she came in and started getting adjusted. We were working to correct her spine and improve her overall health. After a few months, she said, you know what? I was on a call list from a local hospital, and they would call me every month or so to check in because of my blood pressure. So there actually was a call list for blood pressure for Dawn. And after a while, they said, we're going to remove you from the call list because you're doing so well. We were never adjusting her to improve her blood pressure. We were adjusting her to improve her health, but she got off the blood pressure call list because of the health of her spine and her nervous system. For me personally, when I was 22 years old, I was on 7 different medications. And I had been to a handful of chiropractors and doctors and specialists and you name it. And everybody was saying they were looking at what's the symptom, how do we treat it? They were always looking at the short-term relief care, but nobody was looking at the long-term. How do we get this person healthier? I get to one doctor up in Minneapolis. He starts working on corrective care and wellness care. Within 3.5 months, I got off of 7 medications. It completely changed my life. Within 6 months, I lost 25 pounds. And over 13 years later, I've been able to sustain those results. So talk about a game changer for me. That's changed my entire life. And I'm very thankful for that and for what that's done for me. But I wouldn't have done that if I only did relief care. I never would have got there because I tried that. It didn't do it. My wife, Bree, she used to get headaches and sinus infections on a regular basis, and we've seen that completely change where her health is significantly improved. We have a patient of ours, Hillary. She used to struggle with cycles and cramps on a regular basis. A lot of times she'd get her cycle and she'd end up in the fetal position because her cramps were so painful. She starts getting adjusted. Pretty soon her cycles are improving. Her cramps are going away. Doing significantly better. She starts losing weight in inches and doing really, really well. And you say, why? Because her body was functioning better. It was getting healthier. I was never adjusting her to improve her cycle. We were adjusting her to help her body work better. And as a result, her cycle did better. One of our patients, Amanda, she used to have headaches on a regular basis. And then if she would stand for too long, her feet and her back would just get so sore. And then now she doesn't have headaches. She can stand all day long at work and she feels fine. She's doing great, just continuing to do well, which is awesome to see. We see a lot of families with kids. So like my kids have been getting adjusted since day one because we know that the birth process can be very stressful for an infant. We know it's hard on a mom. It can be hard on a child too. So we see a lot of kids from the very beginning and then as they develop. And I'm not adjusting my kids because they have pain. If they do, I will, but I'm adjusting them because they're developing. Their spines are growing. In a child's first year of life, their spine will grow by 50%. It's the fastest time of growth in their entire life. And then in the next 5 years, it will grow by another 50%. So those first 5 and 6 years are so important for the development of a child. And the nerves are the things that are communicating life to the heart, telling it to grow from this big to this big, or develop normal lungs or a digestive system or a reproductive system. The nerves are doing that. They're helping grow and develop the systems. And the healthier the systems are, the better the development of the child. And that's what we want to see. And so I get my kids adjusted so they can function well and have healthy systems, and they do really, really well. We see so many families where they talk about they had a couple of kids and then they started care and they've had kids since then. And so many of those families, the consistent theme that I hear is it's so much easier to raise a child when they're beginning adjusted from the beginning because they have better health. They just develop simpler. It's easier to parent. And just consistently, we see that across the board where parents rave about that. I just had a couple of patients today. One of our patients came in and he said, "Hey, Dr. Neal, I want to thank you. I haven't been able," he's big into horses. And he said, "I haven't been able to race horses in the last couple of years. And I'm back racing again now that I've been here getting adjusted." It's just," and he shook my hand. It was awesome to see. He was so excited. But it's just phenomenal to hear that story. And that's not because we were adjusting for relief care. He'd been to other chiropractors. It's because we started to work to correct his spine. And here he is a few months into care and he's racing again. Another one of our patients, she just had her first year anniversary. It's 1 year that she's been under care. And a year ago, it was hard for her to work even a half day. Now she just said, "I put in an 8.5-hour day just a couple of weeks ago. I never would have been able to do that. And I just, my ability is so much more." And then she's got grandkids that she's helping take care of on a regular basis. And she's saying, "I would have never been able to been a part of their life. And now I have." And she's just got a smile on her face and thanking me for it. And I'm just saying, hey, this is your body working better. You're designed to be healthy. You're living it. Good job, because it's a commitment, but you're worth it. And it's just awesome to see. These changes, they happen because people are functioning better. Their bodies are getting healthier. And that's the main purpose of the adjustment. It's not necessarily treating symptoms. We see them improve, but because people function better. And so if you're wanting to do that or see if that can make a difference for you, the best thing that you can do is just get checked. In our office, we're called Inspired Chiropractic. You can look us up online, Inspired Chiropractic in Sioux Falls, South Dakota. Our number 605-330-4100. If you want to call and set up an appointment, you can definitely do that. And we can see where we can help. If I can help, I'll tell you. If I can't, I'll tell you. But you'll at least know what's possible for you. But so many of you too, you're going to listen to this and you're going to think of somebody you know. What about this person? My friend, my family member, just a person in your life where you want them to hear some of this. As you do, just write their name in the comment below or share this with them, because that can make a world of a difference. It's just having somebody connect the dots for you. And if this video can help do that, we definitely want to do that. So make sure you share this or write people's names in the comment below if you think it can make a difference for them. But other than that, if you have questions along the way, contact the office, meet with me, and I'll see where I can help. The biggest thing is getting specific detail on each person, each individual, to find out what's possible and how can you be helped. And from there, it can just change your future or redirect how you be more intentional with your future. So all that to say this, I hope this can be helpful. I hope that this can help you understand the differences in chiropractic and really empower you to make decisions on what really would be best for you in the short term, but also in the long term too. And if we can be a part of that, great. If not, that's okay too. So have a blessed night, and we hope to hear from you soon.